All right, so to get started, we'll start by talking off about the medications that are included in the new guidelines. So antibiotics, including penicillin, biomycin, Xanel, Zactran, special formula, including many others. Modified live vaccines, including Express and Pyramid, for example. Any drug or substance listed in the in the schedules to the Controlled Drugs and Substance Acts. Most of this is for small animal medicine. This is narcotics and controlled drugs. And finally, it's all the drugs or substances listed in the prescription drug list. So some of these include dexamethasone, Predef, acepromazine, bioestravette, and meloxicam. There's a website that outlines all of the drugs. A lot of them are not important to large animal medicine. Now, this is the sheet that I've handed out to everyone. It just goes over the antimicrobials that require a veterinary prescription. The antibiotics are divided into 4 different categories, just depending on their category of importance. So category 1 is the drugs that are used for serious human infections, and there are no alternatives products that can be used. These are the most important antibiotics. So some of these include Baytril, Xanel, Ceftiofur, Spectramast, and special formula. The second category of drugs are fairly high importance. These are the ones that are used for treatment of serious human infections, but there are some alternatives that can be used. So drugs that are included in this list are Tylan, Depocyllin, Lincomycin, Penicillin G, and Tylan. Category 3 are our medium important drugs. These ones are drugs that are used to treat human infections, but there are some alternatives that we can use. This includes drugs like biomycin, Calf-Span tablets, Lincomycin, Neomycin LA, Onicin, and Oxy-LA. Finally, moving on to category number 4, these drugs are not used whatsoever in human medicine, so there is no change to these drugs. These drugs include Amprol solution, Monensin, Rumensin, and Flavomycin. Now that we've covered some of the drugs that require prescription, we can move on to what producers require to actually get a prescription. So first off, they need to establish and meet the conditions of a valid veterinary client-patient relationship, or VCPR, in regards to a specific animal or a group of animals. Secondly, we need evidence-based determination for the need of medication or the prescription. Third, we need proper medical documentation of the prescription by a ABVMA registered veterinarian. And finally, we need a veterinarian to provide oversight of use and appropriate follow-up in regards to the case. As producers, you really only need to be concerned about the first 2. I'm going to explain a little bit more about what is required and what defines a veterinary client-patient relationship, as well as what defines medical need. So a veterinary client-patient relationship, or VCPR, is the following. The vet has assumed responsibility for making recommendations regarding the health of animals and the need for medical treatment. The vet has sufficient knowledge of the animals on which is based off assessment, diagnosis, and treatment of the medical condition of the animals. Now in the smaller print, it kind of goes on to talk about that we need to have a recent interaction with the animal owner, caretaker, and the animals, as well as we need to be acquainted with the environment that the animals are raised in. Number 3 is that the client has agreed to follow the vet's recommendations and the prescription, and the vet is available for follow-up care if required. Once again, there's really only 2 key points that are most important for producers. Now we'll go on to discuss a little bit more what it means by having medical need. So evidence-based medical need means that it is the responsibility of the veterinarian to establish evidence that there is medical need to prescribe the drug, either on an individual or a herd basis. So evidence for medical need results from having a significant or relevant amount of information with respect to the health of the animals. So this can include having a medical history or current physical exam of the particular animal, having laboratory results from past disease outbreaks, including postmortems or live animal samples, or production data, knowing that every year we have some incidents of pneumonia, some incidents of calf scours. It's not necessary that an individual animal is examined in every instance that a vet issues a prescription. Vets may appropriately prescribe the drugs based on an exam and or relevant knowledge. So this kind of goes back to knowing that we're going to have some incidents of disease on a farm every year. So as vets, much to your surprise, we do actually try to make things easier for you. What we can do is we can make animal health protocols. So these protocols, we make in advance for predictable animal health events based on previous history and anticipated illness. So vaccination, processing, arrival on farm, or those cases of calf scours. It's not a prescription, but it establishes our medical need. So if we go on to an example animal health protocol, as we've been talking about scours, this would be a typical protocol for scours. So one, on farm you'd identify those calves that have a hunched back, a soiled perineum, and failure to get up. You'd record that ear tag in your records. You'd take a temperature and record it. You'd provide oral electrolytes. Now if the temperature is over 39 degrees Celsius, you're going to treat with Nuflor and you're going to administer Banamine. You're going to move to a treatment pen, and if the treatment fails, then you'll contact a vet. Now, if the calf does have a temperature of over 39 degrees, you've followed your protocol and you've established medical need. So because you have medical need, you can get a prescription. So you're able to come and pick up the medication or the Nuflor and the Banamine needed to treat those calves with the outbreak of calf scours. Now these final two points on this slide really just pertain to us as veterinarians. We just have to have proper medical documentation that we have seen the animal, prescribed the treatment, and why, as well as we have to provide oversight of use. Now what this means is we don't need to necessarily see you treat the animal, but we just need to be available for follow-up care if there's an adverse reaction or if the treatment doesn't work. Now what we need to include in the prescription is the group of animals or animal, so pen 205, first calf heifers, number 36N, the drug, the dose, and the duration of use. So you can see from our calf scours label that we have 200 calves born in spring 2017, Nuflor 300 milligrams per mil. We have that we're going to use 6 mils per 100 pounds body weight, and we're going to give that subcutaneous injection just once. We're also going to have more information on the label, including withdrawal times and precautions and warnings, as well as the number of refills. Now, refills are typically established based on that prevalence of disease on your herd in previous years. So this is something that your veterinarian will establish with you based on your past history. Now, we'll go through a few scenarios just so that everything comes together a little bit clearer. So, scenario 1, a veterinarian provides services for a cow-calf producer, including examination of some infected animals, consultations in herd health, animal health protocols for animals entering the backgrounding operation, calf disease treatment, and cow vaccination. The vet maintains medical records that document these interactions. 60 calves out of a pen of 300 are showing reduced feed intake, lethargy, hunched appearance, and some coughing. The veterinarian reviews the producer's medical records, which documented the occurrence of respiratory disease in a similar group of weaned calves over the past 3 years. Medical records include postmortems performed and lab results from samples. A diagnosis of Mannheimia hemolytica was previously made in the investigation. Does the veterinarian have the required information necessary to establish the medical need to prescribe antibiotics for this group of calves? Yes. So underlined in red, we have a current veterinary client-patient relationship established. In green, we have the medical need, knowing that there's reduced feed intake, lethargy, etc. Underlined in blue, we have the medical records, and then in purple, in the very bottom, we also have that the vet has the obligation to follow up with the prescribed treatment if there's an adverse reaction or if there's failure of treatment. So scenario 2, a client brings in a cat to the vet clinic for a castration and mentions that they also have backgrounding of some calves. The next day, the producer stops in at the practice to purchase some antibiotics and some Banamine to treat an outbreak of respiratory disease. Does the veterinarian have an established VCPR to prescribe drugs? No. So why not would be that the client is mentioning that they background some calves, but it's not enough to establish a VCPR. So we can recall that the vet needs to have sufficient knowledge of the animals to which base our diagnosis on. We need to have a recent interaction between the animal caretaker as well as the animals, and a recent interaction with the environment as well. Scenario 3, a cow-calf producer stops in a veterinary practice to pick up drugs for processing bought calves, including vaccines. For example, modified live respiratory vaccine, Bactrim Clostridial 8-way, along with antibiotics for treatment on arrival. These are the same products that the farmer has been picked up for the past 10 years. The only record of the veterinarian being out on farm is for a rectal prolapse correction in 2015. Once again, does this give us medical need? Unfortunately, no. So this is where it gets a little bit more complicated. So there we go. We don't have a valid VCPR for the following reasons. The veterinarian hasn't been out on farm lately. We haven't had a recent interaction with the animals. And unfortunately, an emergency situation with one animal is not considered being acquainted with the animals on farm or the environment. So to sum this all up, what does it really change for producers? 1, medically important antibiotics require a prescription. Antibiotics cannot be dispensed anywhere except a veterinary clinic or pharmacy. 3, we have to have a valid VCPR in order to get a prescription. And 4, medical need is required to get that prescription. Why are these changes being made? Now, I'd like to say just because the government's being difficult, but there's also a lot of other reasons. So the main reason is because of antibiotic-resistant bugs and bacteria. In the past, I'm sure you guys have all used penicillin to treat animals, and as we know, penicillin is not as effective at the same dose it was 30 years ago. Well, a lot of this is because these bugs that are causing disease are becoming resistant to the antibiotics that we want to use. So now we have to use stronger drugs and drugs that we use in human medicine that can really have a human health impact. So some of the drugs that are used in animal medicine have really similar mechanisms to the ones we use in human medicine. We really want to protect those drugs to make sure that our human health aspect is safe. We also want to take antibiotic stewardship into consideration. What this means is choosing the right antibiotic at the right dose and the right duration. If antibiotics are the right course of treatment for specific disease, then vets try to choose the most appropriate drug, dose, duration, and route of administration to optimize the treatment and to save on-farm antibiotic costs. We can also try to make environmental, vaccine, and management recommendations to avoid using antibiotics in certain cases. We also are trying to increase our antibiotic stewardship because there's changes in other parts of the world, including the EU, which have much more strict regulations. So certain countries in the EU actually have vets have to come and do all antibiotic treatments on farm. So our hope is that if we can implement some of these regulations, we can not end up going down that route and instead be able to still let farmers and producers treat their own animals. Do we have any questions?
I have one.